For today, we'll cover 2 more viral pathogens, the hepatitis viruses and also HIV virus. And by the end, I will show you some example questions for our exam, for our final exam. Yeah, Happy New Year. Thank you. And I hope that everyone is safe, especially during the pandemic. And stay home, stay safe. Try to protect your family. And if you have vaccines available in your country, try to get it. Thank you. Yeah, your Chinese is pretty good. Yeah, thanks. And by the end, we'll talk about some example questions, but it doesn't make a lot of sense because we have already had several tests. It's the same pattern in our test. And another reminding is that in a couple of hours, in several hours, we'll have another test, the 7th test. That's the last one. And you need to finish in 3 days. So that's Thursday, Friday, and Saturday. Sorry, that's my New Year gift for you guys. It's a test. And yeah, the final exam is on January 6th. And hopefully, by having this test, you will feel better for your final exam. And when you prepare for your final exam, try to go over your test again, and it will help. Okay? All right, so we'll first talk about the hepatitis viruses. As in this word, hepatitis means that this is related to liver. So this group of viruses can infect liver cells. Well, here, liver cells not meaning because in the liver there are a lot of types of cells, including immune cells. And hepatitis virus can infect the major group of cell in the liver. So that's hepatocytes. Hepatocytes are the major cells making up the frame of the liver, making up the frame structure of the liver. Those are big cells which are very active. So hepatitis viruses include several different types. In English, we name them with letter A, B, C, D. So from hepatitis A to hepatitis E virus. And they are different. Some of them are, what happened? Something wrong. Some of them are RNA virus, while some of them are DNA virus, or one of them is DNA virus. And we'll go over one by one, and we'll learn their structure, and we'll learn their their genome composition, whether it's DNA or RNA, and also we'll learn how they cause disease, what type of disease they can cause, and their infection route, and how to prevent them. So in a similar pattern, we'll go over the viruses one by one. This form is a quick summary of all the hepatitis viruses from A to E. And you can see here, there are different characters of the virus, including which family they belong to, their genus, and virion size, whether they have some envelope, and whether they and what their genome, whether it's DNA or RNA, and genome size, their stability, transmission, and in several aspects. So different characteristics of hepatitis viruses. And you can go back to this form again after you learn all the viruses, and we'll go through the viruses one by one. First, A, hepatitis A virus, short for HAV, because the name of different viruses, some of them are not easy to pronounce, and we usually call those viruses with several letters, like HAV, HBV, HIV. Hepatitis A virus belongs to the heptavirus, which can infect livers. They look like spheres, and their symmetry is cubic, and they don't have envelope. Their genome is RNA genome. It's 7.5 kb RNA genome. So this is a basic information on HAV. And HAV, because they don't have envelope, they are stable to treatment with ether, acid, and heat. These chemicals is ether, acid, heat, or alcohol, because they don't have membrane, they don't have envelope membrane. They are pretty resistant. Some primate cell lines can support the growth of HAV, but HAV infection doesn't cause the cytopathic effect. We learned cytopathic effect before, so that's what you can see when you infect a monolayer of cells with some virus. And HAV cannot kill those monolayer cells. Is something wrong with my voice? Can you hear me? In Ring Classroom and also in Ding Talk? Okay. Okay, seems that it's not my problem. Okay. So this is the genome organization of HAV. It's pretty big. It's 7.5 kb RNA, and it's single-stranded. So there is only one strand of RNA, but this strand is positive. This is similar to this pandemic coronavirus. Coronavirus is also a single-stranded positive sense RNA virus. But for coronavirus, it's much bigger than HAV. HAV genome is 7.5 kb. Coronavirus is even bigger. You don't have to remember this structure in detail of the genome. Just keep in mind the size of the genome and also the property of the genome. It's single-stranded positive sense RNA. Transmission of HAV is a fecal-oral route, so the virus can present in feces and through ingestion of contaminated food or water, the HAV can infect some individuals. Incubation time is about 4 weeks, so that's pretty long. Relatively large quantities of virus are shed in the feces during the incubation period before the onset of clinical symptoms. And that's one thing we should keep in mind, because if you can identify some infected person, they might show symptoms, but they are already be able to release the virus in their feces. So during the incubation time, they can release virus. For clinical findings, it can be subclinical, or it can cause some hepatitis. And now we don't have any evidence that HAV infection can lead to chronic liver damage. Usually the patient can recover quickly, and they don't develop into chronic liver damage. This is the onset of HAV infection. Time 0 is the time of exposure, of virus exposure. And for the first 4 weeks, almost 4 weeks, there is no symptoms. And so that's the incubation time. And the level of detection in this area is pretty low. You cannot detect either IgM or IgG. But after about 4 weeks, IgM can increase dramatically. And later, IgG follows. So IgG. But if you detect the virus in the blood by using other methods like PCR or other molecular methods, you can detect virus in blood after 2 weeks of 2 weeks after exposure, and viruses in feces 2 weeks after exposure. And also later stage, you can also detect the aminotransferases. This aminotransferases means that there is some damage in the liver, and the lysed liver cells, the hepatocytes, can release this aminotransferases. There's different events after HAV exposure, and prevention and control of HAV. First, we need to be careful. We need to interrupt the fecal-oral spread. So make sure the food or water or drinks are not contaminated by feces or other thing containing HAV. For some people, after exposure, we can give them passive immunization. So we can give them immunoglobulin before or early in the incubation period. And this can prevent the onset of the disease. Or we can also use active immunization. So that's the vaccine or vaccination. Usually HAV vaccine is a killed, inactivated HAV virus. And I think in China, all the kids are receiving HAV vaccine when they are young so that they can get protected. This is prevention and control of HAV. Next, that's HBV. HBV is more famous than HAV, especially in China, because in China, in the society, a lot of people are or were infected by HBV, and they are either a patient or carrier, and takes a lot of portion of the whole population. One reason is that the application of HBV vaccine was late, and it was only in 1990s that the vaccines get used for the whole population. And before that, there was no useful vaccine. They belong to the hyperdNA virus, so it's a virus which can infect the liver, and its genome is DNA. And if you check HBV virus with electron microscope, you can identify 3 morphologic forms, 3 different types. The first one is a small spherical particle, like this one. This small particle. Another one is this tubular or filamentous particle, like this. They are long rods, tubular. A third one is dim particle. It's like this. It's spherical but much bigger, and you can see the structure here. These different types of particles contain different material. First, the small spherical particle, this one, they are just 20 nanometer protein cluster. They made up by HBV surface antigen. So surface antigen molecules come together to form this 22 nanometer small particle. And the tubular or filamentous particle, like this one, it's also made up by the surface antigen, solely the surface antigen. And the diameter of the tubular is also 22 nanometers, same as a small particle. But it's pretty long. Sometimes it's over 200 nanometer long. So that's pretty long. So this is a tubular one. And the dim particle, the big particle, spherical, diameter of it is 42 nanometer, and they show this spherical structure. And this is actually the infectious form of HBV. But when you check it with electron microscope, this one is less frequently observed. This big particle contains the surface antigen surrounding on the surface, making the envelope of the virus. We previously learned that for most of the virus, their envelope is just the membrane from host cell. So it's bilayer lipid membrane. But for its HBV, the envelope is the surface antigen protein. It surrounds a core, a nuclear capsid core inside, which contains HBV core antigen and its DNA in it. Later, we'll learn the detailed structure of this dim particle. Genome of HBV, it's pretty interesting because its genome is like this. It looks like a double-stranded circular DNA. See, some part of the genome is double-stranded. It's circular, but problem is that it's not a complete circular double-stranded DNA, because at some parts it's double-stranded, but the other parts, this part, is single-stranded, and it's a circle, but it's not complete. So we call it partially double-stranded circular DNA. The size of it is 3,200 BP, so that's 3.2 kb in length. There are 4 open reading frames, including some important antigens, for example, S for the surface antigen, and C is for the HBC antigen. Okay. And before they make the mature antigen, they make the pre-antigen first, pre-protein first. For example, for the pre-C to pre-C protein to the HBE antigen, pre-C protein to further modify to the E antigen. And also they encode some P reading frame. That's a polymerase. It's a DNA polymerase. Has the reverse transcriptase activity and RNase H activity. X is a transcriptional transactivator. So these are the 4 open reading frames. This is the life cycle of HBV. First, the virus attached to the cell. Well, this is a liver cell. And after entry to the cell, there is uncoating. So it releases its genome to the intracellular part, and then further transport to the nucleus part. Because this is a DNA virus, we talked about DNA virus before. And for DNA replication and DNA transcription, the DNA genome needs to get into nucleus. And there, the host DNA can repair the partial double-stranded circular to make it to complete circular DNA. And then there is transcription to make mRNA in different size, 2.1, 2.4, and 3.5 kb mRNA. And those mRNA are needed to translate into proteins. But in nucleus, they cannot transmit into proteins. So the mRNA molecules is transferred to the cytoplasm, and there it can translate into proteins to make the capsid. And one of the RNA, the biggest RNA, 3.5 kb mRNA, is further reverse transcribed into DNA strand, and first the negative strand DNA, and then further the positive strand DNA to make the incomplete or partially double-stranded DNA genome. And there, the new viral particle is formed. Then this new viral particle might be released to infect other cells, or it can re-enter the cycle to in the same cell. So this is the life cycle or replication of HBV. Pathogenesis of HBV. Transmission. The major route of transmission is blood transfusion, and also in blood products containing HBV. So that's the major one. But it can also be transmitted through the vertical transmission route. So the mother can transmit HBV to her kid, to her offsprings. Or there is a close contact transmission, especially sexual contact, and that can also transmit HBV. During the HBV infection, antibody and cell-mediated immune responses during infection may cause autoimmune phenomena that contribute to disease pathogenesis. So that's the reason of why the virus can cause disease, because the immune system can respond to make antibodies and CTL, the CD8 positive T cells, and those T cells can attack the viral infected cells and lyse the viral infected cells, and this is the immune response. HBV infection can cause liver damage. Incubation time is about 1 to 6 months, and that's different incubation time. There might be some acute infection, so that's the onset of the disease is quick after exposure, so we call it acute infection. It might be subclinical. There's no obvious symptoms at the beginning, but then later it can develop into clinical, including like hepatitis or fulminant hepatitis. So that's fulminant hepatitis means that the hepatitis uh, condition is critical and the damage of the liver is in large area. Then after the disease episode, the viral can become chronic infection. But this doesn't happen in everyone. In some patients, the immune system can clean out the virus and the patient can recover. But some patients can develop into chronic infection, so they become a carrier of the virus. And the virus can be detected in their blood, in their liver for a long time. And during this time, the patient will look healthy, but later this chronic infection might cause future problems, including cirrhosis, end-stage liver disease, like cancer in the liver, including like carcinoma. So this is a clinical results of HBV infection. For laboratory test, we can detect the serum HBV DNA. That's the molecular method. We can use either nucleic hybridization method or PCR, real-time PCR to detect the viral DNA directly. Or right now in the hospital, more popularly, it is used the serological test. We use the patient's serum and detect antigens and antibodies in the serum. In this table, it shows us the results of a serologic test for HBV and also the meaning of it. For example, you can detect the surface antigen, E antigen, HBV DNA, or antibodies against different antigens, like core antigen, IgM or IgG, or antibody against surface antigen, antibody against E, C, or other different antigens. And if you can detect the surface antigen, that means there is HBV infection, either acute or chronic, and there is a virus in the body because the virus can shed the antigen protein molecule into the blood. But if you can detect the antibodies, it will mean different thing. Maybe there was some infection before, or that the patient got vaccine before. And those vaccine we'll talk about later. HBV vaccine contains the surface antigen. Okay, so this is a laboratory diagnosis. And this is another form showing different markers for serologic test. Assay results for surface antigen, anti-surface, anti-core, and according to which one is positive, which one is negative. And this interpretation can tell you the status of your patient's body, whether there is active infection or there was previous infection or the patient is immunized. So I'll leave you guys this table to go over it for detail to understand it. And this is very useful because you need this table to explain to your patient, to let your patient know their real condition, their status. Prevention and control of HBV. We can use interferon to treat the chronic infection, and interferon alpha can inhibit HBV replication. And HBV immunoglobulin may be administered within a week of exposure to the newborn infants of the surface antigen positive mothers. So that's one useful method, because previously the vertical transmission of HBV is a big problem. And once the mother is positive, her kids will probably caught positive. But if now we use immunoglobulin to prevent infection in the infant, the baby can be healthy. Or we can use HBV vaccine. This is a subunit vaccine containing the surface antigen, HBs antigen. There was a story on HBV vaccine. Actually, the different countries tried to make HBV vaccine for a long time in 1970s, 1980s. But after the development of molecular biology in America, some scientists and some companies realized the power of molecular biology. They clone the gene and they express the HBV protein and use it to make vaccine. And it was commercialized in America first, and a company called Merck, they set up a factory to make the vaccine. At that time, in 1980s in China, we didn't have vaccine at that time, but they tried. The government want to produce vaccine and try to buy the technique, and Merck sold the whole system, including the training of technicians and workers in China to make the HBV vaccine, to set up factories to make the vaccine, and with a pretty low price. And it was at that time that China began to use HBV vaccine, and it got popular in 1990s. And now, like in almost in other countries, HBV vaccine is given to babies, almost the first vaccine for every kid, and it's free. Another virus is hepatitis C virus, we call it HCV. This type of virus is classified as family Flavi. Sorry, I cannot remember. I cannot pronounce this word. It belongs to the genus of Hepatitis C virus, and this again is a positive stranded RNA virus. It's a single-stranded, positive sense RNA virus. It does not grow in cell culture, but can infect chimpanzee. That's expensive. HCV displays genomic diversity. Because HCV cannot be cultured in cell lines, right now we don't have a method to make HCV vaccine. So currently there is no commercially available HCV vaccine, and their genome, displays diversity, means that it's a barrier to make some vaccine. It's not easy to target all the diversities. But good news is that in right now there are some medicine available to fight against HCV, and those one of the medicine was developed in New York. I don't know whether it's NYU or Columbia University. Yeah, I know these are Latin or Greek words, so it's not easy to pronounce them, and it's not easy to understand those words. Yeah, the good news is that we do have medicines available to treat HCV infection. And according to what I heard in previously, those medicines are actually pretty good. They can inhibit the virus with pretty good effect. And this is the HCV genome. Yeah, again, you don't have to remember it. Just remember that it's RNA genome, and the size of the genome is here. It's not labeled here. Just remember it's a positive stranded RNA virus. And okay, the features of HCV virus infection transmission is similar to HBV. Its transmission is through blood or sexual contact. So it's pretty similar to HBV. Incubation period is average incubation period is about 6 to 7 weeks. So that's not, this window is not too big. Most new infections with HCV are subclinical. So it means that not everyone is showing the symptoms. But once it shows symptoms, the condition is not good. And the chronic for a lot of infection is it can develop into chronic hepatitis, and some of them can further develop into hepatocellular carcinoma. So that's cancer. So HCV can also lead to cancer, carcinoma, and also HBV. And for HAV, it doesn't cause chronic disease. So this, when you learn these different viruses, you just, for each character, you just compare different viruses. That can help you to understand and remember these contents. For laboratory test of HCV, we can test the serum. So that's a serological test. But right now for HCV, the reliable tests have only recently become available. Previously, not like HBV, the HCV test is not available. HCV specific IgG indicates exposure, not infectivity. Or we can use PCR to detect the viral genome in patient's serum. So that's not a big issue. Even though it's RNA virus, we can use PCR to detect RNA molecules. Prevention and control of HCV, as I mentioned just now, there is no vaccine available for HCV. We should reduce the risks for HCV infection, such as screening and test blood, or for patient with active infection, we can use interferon alpha to infect our interferon alpha to treat the patient. And the anti-HCV medicines are available, so that's good. And we should try to avoid the transmission of HCV. For example, test the blood or the blood product. Make sure that those products are not contaminated by HCV. Or for everyone, we should get protected during a sexual contact. Another one is HDV. HDV is kind of interesting. Remember previously we learned the concept of defective virus. Means that it's not a complete virus. It cannot set up infection by itself. It needs a helper virus. And HDV is one of it. The virus is about 36 nanometer in diameter. And its surface is not some protein from itself. It's from HBV virus. That's HBV surface antigen. It's derived from HBV virus. And it also contains delta antigen inside the surface. So the delta antigen is encoded by the virus. The virus particle is also single-stranded RNA. Single-stranded RNA. Genome size is about 1.7 kb. 1.7 kb. So this is the schematic drawing of HDV structure. Because it's a defective virus, it cannot set up infection by itself. It can only happen in HBV infected persons, infected individuals. So it can set up co-infection with HBV. It requires HBV as a helper virus in order to replicate. And the infection only occurs in patients who are already infected with HBV. Spread of HDV is also in either blood, semen, or the vaginal secretion. So technically it's similar to HBV, either blood transfusion or sexual contact. It replicates and causes disease only in people with HBV infection. And the replication of HDV can result in cytotoxicity and liver damage. That's why that when you can detect some HDV infection, that patient's condition might be not good, and it's might be even worse than the HBV infection. So that increases the severity of HBV infection. It can cause fulminant hepatitis. So that's a co-infection from two pathogens. Even though HDV cannot replicate by itself, and the co-infection can lead to severe disease. Laboratory test, we can detect the delta antigen, or we can detect the delta antigen antibody in the serum. And keep in mind that even though it contains the HBV surface antigen, you cannot use that as an indicator. You need to use some HDV specific molecule to detect HDV. So another way is to detect HDV RNA using real-time PCR. It's a laboratory test. Prevention and control of there is a typo in the title. That's prevention and control of HDV, not HCV. It's a co-infection of HBV virus, so prevention of HDV is similar to HBV, and HDV infection can be prevented by vaccinating HBV susceptible persons with hepatitis B virus, HBV vaccine. But vaccination does not protect HBV carriers from superinfection by HDV. So that's interesting that to protect from HDV infection, you give a person some HBV vaccine. Because without HBV vaccine, HDV infection cannot happen. I think for most of you guys, because you are young and you probably get enough vaccines when you were kids. If you can remember, I think everyone got HBV vaccine before, right? Is there anyone never got HPV vaccine when you were young? Is there anyone who never got HPV vaccine? Yes? Well, if you are sure that you never got HPV vaccine, I would strongly suggest you to go to hospital to get the shots. Okay, you got, great. And even though you got HPV vaccine a long time ago, when you are young, maybe 20 years ago, probably you are not protected right now because the efficiency of the vaccine is maybe not high enough, and your body might response to virus infection, it might be very low. So you want to check, you have a HPV test and check whether you still have antibodies. If you don't have antibodies, probably you are not protected. So you can get the vaccine again to help you stay healthy. Well, everyone has sign of vaccination on upper arm muscle. Probably that's not for HPV. Probably that's for BCG injection. Yeah, for you guys, you never got the smallpox. Yeah, that's a BCG. Yeah. Especially in future, when you are a doctor, you work in a hospital or you're in your own clinic, you probably will have a higher chance to get in contact with your patient's blood. And probably one of your patient is infected or is positive, and you need to get yourself protected. And you need to get the vaccine before you practice your career, your clinical practice. So this is HDV prevention. Okay, the last one is HEV, hepatitis E virus. And again, this is also a positive stranded RNA virus. The genome size is pretty big. It's also 7.5 kb. The bacteria, the viral particle is a non-enveloped particle. Diameter is about 30 to 32 nanometer. So this is the HEV. Transmission is also fecal-oral route. So remember previously we learned another virus which is also fecal-oral route. So that's the first one. So A to E, so that's ANE. HAV is also fecal-oral route. The symptoms and course of HEV disease are pretty similar to those of HAV disease. So it's similar. And again, we are back to this table. This is a summary of all the hepatitis viruses from A to E. And we talk about one by one, so each column of it. And when we talk about each virus, we try to compare them. And when you go over our material, you want to come back to this table and compare different viruses so that it can help you to remember. Okay.